So guys, we actually did a whole, how will I say it, a whole like series of lectures on peritonitis, but we actually missed this concept out. Very important concepts, and that's the SPB. That's what spontaneous bacterial peritonitis. And when you say something is spontaneous, that means the thing is just occurring just like that, occurring on its own. You don't really know the cause. You don't really know the source. All right. And if you have bacteria infecting the peritoneum like that, without you actually knowing the source, it's usually a problem. All right, because you have difficulties in trying to treat. So for this SPB, we say that it's a life-threatening infection of the peritoneal fluid in the abdominal cavity, and it's occurring without apparent source, or it is not as a result of what? Surgery complications. All right, causes now, possible causes. Like, you don't really know the source, but some things that you could think that they could possibly cause that. All right, it could be due to liver cirrhosis. It could be due to what? Ascites, which is accumulation of fluid in the abdominal cavity. It could be due to what? Gastrointestinal bleeding. It could be due to what? Bacterial translocation from the gut. Now, bacteria are moving from the gut to the peritoneum. It could be due to some immune dysfunction. Then symptoms. If a patient has SPB, what are their likely complaints? You could complain about abdominal pain, tenderness, fever, chills, nausea and vomiting, diarrhea or constipation, abdominal distension. Alright, so you can see this. Bacterial infection with or without identifiable source, right? Diagnosis now, you do paracentesis, which is what? Fluid sampling. You do laboratory tests, you do what? Imaging studies like CT scan, ultrasound, and the rest. Treatment, because you don't really know the cause, you might just want to use what? Broad spectrum antibiotics, so that anything that is a bacteria there will be cleared out. It's just like you have declared war on any bacteria, okay? So broad spectrum antibiotics such as what? Cefotaxime, ampicillin, sulbutamol, right? Then fluid management, you could give intravenous fluid, give albumin, right? Pain management, supportive care. The patient is having difficulties in breathing, you give oxygen therapy, nutrition, and all the stuff, right? Complications. A spontaneous bacterial peritonitis could lead to what? Septic shock, multi-organ failure, hepatic encephalopathy, where you are having some brain problems due to liver dysfunction, right? Acute kidney injury, and ultimately could result into death, right? Prevention. Give prophylactic antibiotics for patients that are high risks of developing what? This type of peritonitis. Alright, prophylaxis is like you are giving before time. Alright. Then vaccination against pneumococcal and Haemophilus influenza. Then managing the underlying disease, liver disease. Then avoid invasive procedures too. Alright. So I think this is note enough on the spontaneous what? Bacterial peritonitis. Alright. A type of peritonitis that is occurring with or without an identifiable cause, right? So definition, causes, symptoms, diagnosis, treatment.